Hello everyone, this is Christian Tamayo and we were gonna talk here about taking good care of the elder person. We all know that elder need care and support, especially in a critical condition because at this stage elder are more sensitive. And there are a lot of various changes when you are getting older, not only physiological changes, but also psychological, intellectual or cognitive changes, which is undergo serious personality changes that we really need to pay attention as a healthcare provider. Now, let's talk about here the physiological changes. There are numerous physiological aspects, but specifically, let's talk about the five special senses. So there are numerous theories on why special senses deteriorates as we age. By the way, as you age, the way your senses, hearing, vision, taste, smell, and touch give you information about the world changes. Your senses become less sharp. As you get old, structures inside the ears start to change and their functions decline. Your ability to pick up sounds decreases. You may also have problem maintaining your balance as you sit, stand, and walk because our ears have two jobs. One is for hearing and the other is maintaining our balance. As you age, the sharpness of your vision or visual acuity gradually declines. The most common problem is difficulty focusing the eye on close-up objects. This condition is called presbyopia. Reduced peripheral vision is commonly in older people. This can limit your activity and ability to interact with others. Weakened eye muscle may prevent you from moving your eyes in all directions. It may be hard to look upward. The area in which objects can be seen gets smaller. Common eye disorders that cause visual changes that are not normal as cataracts, glaucoma, macular degeneration, and retinopathy. The sense of smell is often taken for granted. That is until it deteriorates. As we get older, our olfactory functions declines. Not only do we lose our sense of smell, we lose our ability to differentiate between smells. It has been reported that more than 75% of people over the age of 80 years have evidence of major olfactory impairment, and that olfactory declines considerably after the seventh decade. A more recent study found that 62.5% of 80 to 97 years old had an olfactory impairment. However, it is widely accepted that taste disorders are far less prevalent than olfactory losses with age. Gustatory dysfunction may indeed be related to the normal aging process. However, in many cases, what is perceived as a taste defect is truly a primary defect in all function. Other than smell dysfunction, the most frequent causes of taste dysfunction are prior upper respiratory infection, head injury, drug use, and idiopathic causes. Chewing problems associated with tooth loss and dentures can also interfere with taste sensations, along with the reduction in saliva production. When presenting to the clinician, older patients with impaired taste should be thoroughly evaluated for oral and pharyngeal disease such as candidiasis. Touch, vibration, and pain. With aging, sensations may be reduced or changed. These changes can occur because of decreased blood flow to the nerve endings or to the spinal cord or brain. Health problems such as lack of certain nutrients can also cause sensation changes. Brain surgery, problems in the brain, confusion, and nerve damage from injury or long-term or chronic disease such as diabetes can also result in sensation changes. Reduced ability to detect vibration, touch, and pressure increases the risk of injuries, including pressure ulcers or skin sores that develop when pressure cuts off blood supply to the area. After age 50, many people have reduced sensitivity to pain, or you may feel and recognize pain, but it does not bother you. For example, when you are injured, you may not know how severe the injury is because the pain does not trouble you. So those are one of the physiological changes of an older person that when it is already affected, then we really need to pay attention to support and to assist them. Like for instance, to avoid accident or any harmful that may harm themselves as an old person. And now, let's proceed to their psychosocial concerns. The common psychiatric syndromes in elderly are subdivided into two categories: the chronic brain syndromes and functional psychiatric disorders. So, for chronic brain syndromes, it includes Alzheimer's disease, multi-infarct dementia, and dementia from other cases. So, for functional psychiatric disorders, it includes depression, mania, and personality disorder. So, the problem described here are the most common with significant impact on quality of life of the elderly patients. So, the problem is natural process in aging. But then again, what they really need is love, affection, and support, especially during this stage. They are too sensitive and emotional because understanding their needs and concerns will ensure their good health. But before I'm gonna end this video, let me remind you something that our elderly is our foundation. Without them, we cannot see how our life is so beautiful. We cannot see how world is so beautiful. And I'm gonna end this with a quote. Caring for our seniors is perhaps the greatest responsibility we have. Those who walked before us have given so much and made possible the life we all enjoy. And that's for all. Thank you for listening. Enjoy.